Good news and bad news on the COVID front this week, folks. The good news first. New South Wales and Victoria, Australia's two biggest states, are getting on with a plan to live with COVID. Businesses in those states, locked down and earning nothing for months on end, may well have the proclaimers blasting from their speakers as those lockdowns come to an end.
I'm on my way from misery to happiness today.
But now, the misery. What opening up will mean for our healthcare system, because our hospitals will experience a serious surge and the strain that will put hard-working frontline staff under. The New South Wales government has released some modelling on what we can expect, remembering none of this is precise, as no forward modelling is. The total estimated peak of people who will require hospitalisation in New South Wales at any time is 3,434 patients across the state, and that'll come towards the end of next month. The state has around 2,000 ventilators in stock. Currently, 67 people are using them. There are about 850 ICU beds across the public and private system. Currently, 177 people are in intensive care. Those gaps will obviously tighten as that surge comes over the next 4 to 6 weeks. But then, as more of us become double dosed with vaccines, it should plateau. So the Premier is projecting confidence.
We know that the double dose vaccination is an enormous protection against hospitalisation. I'm incredibly proud of the way in which our citizens have responded and come forward to get vaccinated. It's just been outstanding. To think that we're at 73.5% first dose already, over 40% second dose already, we are really, really doing well.
Should we believe her? She's been wrong before, more than once, claiming this original outbreak was under control. But this time, she's been backed by some respected academics, including infectious diseases expert Robert Boy, who I spoke to last week.
Yes, I do believe hospitals can handle it. Of course, they're pressured. I'm a former clinician. I did paediatrics for 30 years. I've done research for the last few. It's patently obvious to me that my very talented and hard-working colleagues in intensive care and emergency department and medical wards, they are up to the task. They've got plenty of reserve. If one hospital gets full, they'll just redirect patients to another. We are more than capable of coping, and much better than anyone did in Europe when literally hundreds died for want of an intensive care bed.
Now, all these numbers may appear grim, but it's grim everywhere, all around the world. Death numbers are awful, but when you compare Australia's figures to most other nations, numbers here are very low. We've got to remember some other numbers too. Businesses going bust, kids not in school, and thousands upon thousands of people who need mental health support. Plus a few other factors. The weather here is warming up, and we should hit those 80% vaccination targets by Christmas, which is a remarkable turnaround from a very slow start. So, with summer just around the corner, could Australia really be on its way from misery to happiness? I certainly hope so.